right, so welcome to all of you. Like I said, feel free to go ahead and change your name, hide your picture, do everything you want to do. I want to go ahead and introduce myself, introduce our team today, talk a little bit about the structure, and we'll go for there. I will say that if you want to, feel free to go ahead and grab pen and paper. We are going to be doing some interactive stuff as well. And then at the end, we are going to have some individualized support in our breakout rooms. So feel free to participate in whatever manner you would like to participate. So I'm going to turn off the stop share while we do introductions. My name is Amy Lopez, and I am a therapist at the Johnson Depression Center. I am also the clinical supervisor of the Educator Wellbeing Support Line. And if you haven't heard that, we're going to talk a little bit more about it today, and how you might be able to access it as an educator. Let me go ahead and turn it over to Dr. Dana Steitman.
Hi, good afternoon. Welcome. Thank you all so much for being here. I am also a psychologist at the Johnson Depression Center at the Anschutz Medical Campus, working with Dr. Lopez, and I'm also a parent of a second grader and a preschooler. And I really, I feel so much, so deeply on behalf of teachers this year. I know y'all have been called to do really impossible things in a lot of cases, and was really grateful to be able to partner with Amy and her expertise through the Wellbeing Support Line to try to offer something small and probably largely insufficient, but something to give back to y'all for everything that I know you've given this year. And I'm just going to throw out a quick story. Again, I want to really recognize what y'all have been through. Just this morning, walking my second grader to school, I've seen a teacher doing it. I saw the principal directing traffic this morning, well outside the scope, I think, of, typical duties. And I know y'all were doing that pre-pandemic too, but here they are stepping in and filling this role, because without bus schedules, the drop-off traffic is that much worse. And, people have stepped up and done these things or been tasked with it. And I know it's been just a really challenging year for a lot of folks. So anyway, that's kind of the personal side of why I'm here, and excited hopefully to offer something, but also to listen and learn from y'all today as well.
Great, thank you. I want to go ahead and turn it over. We have some people helping us today. They'll be monitoring the chat. And so if you have questions, feel free to put them in the chat as we go, and our team will be answering them. These are also the people who are going to be joining you in the breakout rooms as you want to talk more about what's going on. So Sarah, would you go ahead and introduce yourself?
You bet. My name is Sarah, and I am just a local area psychologist who volunteers at the Educator Wellbeing Helpline. Thanks for being here, and you've almost made it to the finish line.
Thank you. Daphne, would you introduce yourself?
Yes. Hi there. I'm Daphne. I'm a master's degree student getting my master's in psychology, and it's good to see all of you.
Thank you. Kimberly, would you introduce yourself?
Yes. Hi, my name is Kimberly Santos Aviles. I'm currently a psychology intern at the Depression Center, and I'm working with Dr. Dana. Happy to see you guys here.
Thank you. And Kiki, if you would introduce yourself.
Hi everyone, my name is Kiki. I'm a master's in social work student at the University of Denver, and I help with the Wellbeing Support Line, and I'm excited, and I'm not excited to be here because I know we're not all excited to be here, but I'm happy to be here and help support. So
great, thank you. And thank you to all of you. I'm going to go ahead and launch a poll now. And part of this is just, if you guys would answer, thinking about what your mental health needs are moving forward. So feel free to participate and answer the poll questions as we go through. So I'm just going to go ahead and get that started. And then I am going to go ahead and move us through our presentation here. All right, so moving forward, I also, like Dr. Simon said, that she is a parent. I am also a parent of a third grader. And again, I will acknowledge that this workshop and even some of the work on the Wellbeing Support Line is born out of love and compassion for those of you who are doing this really hard work at a really hard time. And we recognize that there's not a lot we can do, but we thought this was something that we could do. And we recognize that it's probably not enough. So Dana came across this tweet that we thought was really funny. And you guys can just kind of say whether or not it applies to you, which makes perfect sense, is that we recognize this is yoga when what you guys probably need is fundamental change. So thank you guys for being with us today and for doing what we can to make that change. So let's talk a little bit about what this year has been like. And as I said, feel free to ask questions in the chat, feel free to comment, feel free to participate in the polls as we kind of move forward. But about a year and a month ago that the stay-at-home orders came into place, which kind of freaked all us out because none of us knew what was going to happen, but we are all in this together. And what that meant for teachers was maybe mask students, maybe working from home, maybe doing online teaching, and for most of you doing all of that at the exact same time, which also meant this. And some of this may look like what you're feeling like at the end of your day. Anybody agree with this? This seem to make sense? So recognizing that this would be a problem, that we had been running a support line for healthcare workers, again, acknowledging that they may need more help because they'd be dealing with COVID patients. In the fall, we recognized that educators were in that same place. They were overwhelmed. There was a lot to do, and it just felt super stressful. So we opened up to educators. I will let you know that the first week we opened it up to educators, we tripled the number of calls we'd had in the previous 3 months. We have now taken over 200 calls from 35 different school districts saying these things. First and foremost, I don't know what I'm doing. Our healthcare professionals, what we heard from them is, this is hard and this is a lot of work, but taking care of sick people is what we do. What we're hearing from educators is, I've never had any training in online teaching. I am teaching kids in person and online at the same time, and I don't know what I'm doing. But interestingly, the teachers also said, not only do I not know what I'm doing, I somehow feel responsible for that. I feel like I should know what I'm doing. Again, I'm overwhelmed, I'm scared, and most importantly is, what about the kids? That first and foremost, people care about these kids and what's happening to them too. So as you're dealing with your own stress and overwhelm and all of those things we talked about, it's what are the kids feeling too? So more than anything, I wanted to put this out there to acknowledge that if you're feeling these things, you are definitely not alone. Good news is there's hope, right? We have a vaccine coming. As Sarah said, we're almost at the finish line. We got maybe 6-8 weeks before we can be done and be ready to move into summer break. But if that's true, then why am I not feeling any better? And I think that's a question when I talk to the educators of, if there's hope and if things are going to get better, then why am I still feeling so icky? And so I want to break this down in a couple of different ways that may make sense to you. And again, feel free to ask questions in the chat as I'm going through. So first of all, I don't know if any of you guys have seen this before, but this is pretty standard of what happens when we have a major disaster. This could be hurricanes, this could be earthquakes. This unfortunately could be mass shootings. In this case, it's the pandemic. And this is how people in the community respond to the disaster. So initially there's an impact, then we reach this honeymoon phase and community cohesion, where everyone's like, how do I help out? And we did the community howls and we clapped for our healthcare workers. And even you guys as teachers got the "we miss you" messages and sending videos and cards to your kids. And then unfortunately that wanes over time. So when you guys went back to school in September is right about the same time we're at the very bottom. And so rather than, again, people buying you lunch and clapping for you, you got lots of angry emails. And why isn't this better? And why isn't my kid learning more? And why do my kids have to wear masks? And all of those questions because people were angry. And unfortunately, educators at the beginning of this year came back into the picture right there. So again, as we move forward, hopefully it's starting to get better, but we still have a good chunk of time where we have to work through the grief and move forward as we're at our anniversary space. So again, for educators, one of the things we found is that once the vaccines were in place and those vaccines were rolled out, we weren't as much in crisis management. I mean, not completely. Some of you guys are still teaching on Zoom and in person at the same time, but we have a better sense of what's going on. Rather, many of you may be moving. A lot of times that can feel the same, that crisis level anxiety may feel really similar to that post-trauma work, and thinking about what is anxiety and what is trauma. And that may be a great conversation to have in your breakout rooms. Oops. Hang on, I have to reshare. Okay. So I'm going to go ahead and turn it over to Dr. Steitman right now, and we're going to do some exercises. So let me go ahead and turn it over here, and we'll go from there to her, and we'll go from there.
Great, thank you, Amy. So just to sort of build on what Amy talked about, you know, between are we sort of still in the crisis phase? Are we trying to shift out of that? I thought maybe we could take a few minutes and have y'all reflect a little bit on what have been some of the major stresses over the past year plus now, and and to what extent are those still present for you? Maybe take a minute and think for yourself, and if you feel comfortable, we are going to share, get a whiteboard going here. And if you go up on your whiteboard under that view options, there should be an option to annotate, and that should allow you to, if you pick text, like I can share, a stressor for me has certainly been, the work from home and parenting, right? Sort of co-occurring. So to the extent y'all feel comfortable, feel free to add a text box and maybe share what some of those stressors have been for you. But also just maybe for yourselves, take note of what have been kind of the big ones, and are they still present? Oops, I saw, Amy, do you know why that might be? I saw someone trying to share, but it's not showing up for me. The other thing is, if y'all want to type them up in the chat too, then we can go ahead and read some of those. So we see uncertainty about the future. Absolutely. Constant uncertainty. Yes. Parents micromanaging from home. I can only imagine how exhausting that must be in your role. Let's see, looking at some of the others. Trying to shift my view so I can see some of these. No boundaries, absolutely, right? That's been a really, I think, surreal experience for us, kind of shifting from one mode to the next, within a minute. More work in the same amount of time. And now how about for y'all, to what extent did those things still feel present? And maybe just thinking about how we could react to that. Maybe I'll just, here, I'm gonna make 2 text boxes. And how about still present, and then people should be able to react to that one, I think. So just go ahead and indicate if you feel like these things you listed are hard are still present for you, or if maybe you're starting to shift out of those. Yeah, for some folks, still present. And that's part of what maybe kind of assessing for yourselves today, a little bit of, you know, where am I in that process and what do I need because of that? And Amy and I will talk a bit more about that in some of the later content today. Feeling defensive about not wanting to be in person, absolutely. Just these constant transitions and trying to navigate and renegotiate our own comfort levels has been so exhausting, right? I think I was reading this, you know, this article that summarized the data on how, you know, our brains are not inherently all that great at assessing risk and in the ways we've been asked to this year. And it's just been an assessment and a constant reassessment. And then we look to others to try to help ourselves assess, and that just tends to leave us feeling more uncertain. So I think that's been really exhausting for folks. And of course, people make different choices and have different risk tolerances, and that is absolutely okay. All right, thank you all so much for sharing. That's cool. That's the first time I've used that feature. I learned about it from Amy. So I'll stop that, Amy, and then maybe we can put the next slide up. Although the next one may be another discussion, so maybe I'll just throw that out there to folks. So how about then, let me see if it is. Ah, yes. So I wanted to ask y'all, what have been, if any, areas like positives you would say, or areas of professional growth for the year? And again, if y'all can't, is there a way to clear this out, Amy? Oops.
Yes. So up at the top, Dana, there's shit here. I can do it.
Yeah, I'll let you work on that.
There you go.
So we know that if you can't connect to anything that feels, you know, like a positive, or maybe an area where you grew or were stretched but learned, that is okay. And if you can, it might be helpful and it might feel nice to reflect on that. Or even when Amy is going to talk about kind of making a plan going forward, what might be some things this year that actually I learned that I want to continue, or I want to keep up in some form, if there's any of that. So if you have any kind of areas where you feel like, you know, there was some growth, feel free to chime up in the text. I'm going to put some for myself. I think I definitely built up skills in task switching, right? Feeling like an accomplished techie. So lots of learning going on in the technology world. Absolutely. Getting quickly engaged. So now these skills in learning the technology are more on board, and that potentially can be something some of y'all might incorporate going forward. Perhaps some of you hope to never see some of them again, and I couldn't blame you there either. More resources. These are really nice. It's, you know, we know also that's something that helps folks recover from difficult experiences, is to the extent they can connect with something, you know, they took from it, or a growth or an area of meaning, that just can kind of help pull them through a little bit. So it's nice to hear, you know, some of you name these things.
So Dana, actually, as you're talking, there was a question in the chat that I just wanted to respond to quickly as we're talking about this, and it was the concept of trauma and whether or not COVID counts as trauma. The DSM would probably, I mean, we could argue that about whether or not it counts, but again, the DSM definition says either, again, a time in which you felt like your life was threatened. And again, a year ago, we didn't know how deadly or dangerous this was. And we know it's dangerous. 500,000 people have lost their lives. So again, I think it's slightly different, but again, one of the differences is this was a societal traumatic event that really, it affected everybody. Although it was traumatic in different ways to different people, there were very few people who escaped any of the trauma of it. So.
Yeah, thanks, Amy. I mean, I would just add to that. Absolutely. I think this has touched, almost everyone in one way or another. And I think I personally believe educators have been in a particularly challenging sector because I kind of liken it to those of us that in my line of work, you feel like you're in these helping professions. For many of you, that pull to be there and help students is strong. And yet it felt like back when we knew very little, it felt like you may have to really be taking a serious risk to yourself or your families to do that. And there was uncertainty about that. And you were getting pressure potentially from various areas to do that. And, and that's just a really tough spot to be in. So I think understandably, it may have felt quite traumatic to some folks. Okay, so now, Amy, if you could work on clearing out the whiteboard, I'm going to share the slides for a moment. And just pull up. So one of the kind of frameworks I was hoping we could use today to try to, again, kind of help y'all think about moving through this as a traumatic experience and reconnecting maybe to a sense of meaning and purpose, because, selfishly, Amy and I, we want y'all who are excellent teachers to stay, right? We want you to be able to reconnect to this work and want to stay and feel, meaning in it. And I like to use this kind of values framework in a lot of contexts, but I thought that this could be a nice way to reflect on kind of the distress of this year a little bit for ourselves and the way that, we might think about values. I like this definition, which I just found on the internet, but I thought it was a nice one. Your heart's deepest desires for how you want to behave as a human being. The idea of like, these values are principles that are aspirational to us. We don't check them off, but they're kind of like our compass or our guiding light, right? And they direct sort of how we act, how we make decisions. And, and probably you have a sense of what those values are for you as an educator. And yet, potentially, as we'll talk about in a few minutes, some of those you may have felt pulled away from for various reasons this year. So I thought maybe we could, as a starting place, just again, pull up the whiteboard and maybe reflect on what are some of your most important values as an educator. And to do this, I'm gonna kind of work you through an exercise that we call the sweet spot exercise. And that is it, and if you feel so inclined, you can kind of try to visualize this and cue up sensory details. But to think about a time within the education domain, so a time in your professional capacity as an educator that you felt just in the zone. You felt like things were as they needed to be. You didn't need anything more in that moment. And this could be actually not necessarily a really significant moment. It could have been a fairly, in some ways, mundane or typical moment for you, in your capacity. And yet for some reason for yourself in that moment, you felt really in the zone. And then to think about what it was about that moment for you that, what was present? What was it that I had that, that helped me feel that way? And what does that tell me about what I value as an educator? And the example I give, I'm not an educator, so I'll just give a different example. But for me, one of the sweet spots that I've been able to conjure up for years now is recalling a time where, and I like to ski, I was out on the ski hill. I was with people that I really loved. It was actually very cold, but in some ways that was kind of energizing and invigorating. And, and I think for me, I still remember that like it was yesterday, and it's when I was 16 years old. I'm getting ready to turn 40. And I think for me, that tells me about my values around friendships and around kind of connection to nature, right? So that's an example of how you might try to pull out some of what you care about in thinking about your sweet spot. So if you want to I'm going to actually stay quiet for about a minute here and let y'all maybe try to pull up that moment and maybe even try to savor it and enjoy thinking about it for a moment if you can. And then if you feel so inclined, maybe share a little bit about some of your values as an educator through the whiteboard. So hopefully folks are able to identify maybe kind of that sweet spot, a memory they recall, a nice memory in your capacity as an educator. Um, and, and even if you weren't, if you kind of can identify some of what pulled you into the field of education, which you value, if you would maybe take a minute and share that here with us on the whiteboard. If you're having trouble on the whiteboard, feel free to also type it up in the chat. It'll go to us as the hosts. So we see relationships. Absolutely. And that works on, I think, multiple levels in educators, with probably colleagues, and of course with your students. Connection. Passion for the content and making it relevant. One of the things I think about as I reflect on some of these you're listing is certainly teaching, I would imagine teaching virtually, teaching online, impacts those, or it's a different way of trying to connect to students, a different way of trying to make content relevant, right? Kind of converting content to online, that a lot of what y'all have done when you've been asked to teach virtually probably intersects with some of these. Feeling like a family with students, being that trusted adults, helping kids find joy in an area that you care about, helping students have the aha moment. Yeah, these are really, really nice ones. So I'm going to stop share here and go back to our slides. Or actually, do you want to put the slides back up, Amy? So we talked about some values, and then so now maybe taking a moment to think about, like, have those values shifted at all as an educator in the pandemic, or have some of the values that you might have named or identified a moment ago, have those now sort of been moved down the line? Have there been other things that have felt more important, perhaps, understandably so, things like safety, stability, kind of just survival, getting through, protecting myself or my family, my students, that some of those things may have understandably taken, the precedence over some of these other things that are what you got into the field for in the first place. And can you go next slide, Amy? And just to talk a little bit about some of what can happen when we have some of these, competing values potentially. So like multiple values, both of which are important, or just potentially feel a real conflict, or feel like we've had to act at odds with what we care about or what we value. So, competing values is something probably many of us have encountered prior to the pandemic, but may have been pulled on more so during the pandemic. Perhaps your value around wanting to really, help students, for example, connect to passion with the material, is you're just not as able to do that because you're exhausted from sanitizing and making sure kids are wearing masks and following all the extra protocols, or staying up late to convert material to online formats. The example I give around kind of a competing values for myself, right? Like I value my kind of role as a professional, but also of course as a parent, and just the hours in the day, right? Those are at odds with one another sometimes. So sometimes when those values are competing and at odds, we can experience distress. There's also this concept of moral distress that has actually been, they talk about it as moral distress or moral injury. And this is something that's been talked about a lot in the healthcare literature. And in fact, among like military and military personnel and veterans, but essentially being like asked or required to act at odds with how we see ourselves. And, you know, basically people we know or ourselves feeling like we did things that just didn't feel good and, you know, maybe violated something that was important to us. And actually, I was trying to do some research, you know, as we were preparing this to look at this in the education sector, because it, to me, you know, I could imagine this may come up and may have come up during the pandemic for folks. And I did find some published data that in fact some teachers were feeling this a bit even before the pandemic, in terms of like limited resources and having to make really hard decisions there. And again, I think that this is just potentially something that could have come up even more within the pandemic, you know, just essentially feeling like I'm not able to be the teacher I want to be because I just don't have the energy, or the school has these rules in place as precautions and I can't do what I want to do, or, you know, or something else, or they've asked me to do this thing that just doesn't feel good. So I think Amy has a poll up, and y'all responded about whether you feel like you'd been pulled away from important values during the pandemic. And here, you know, the options were quite a bit, somewhat, not at all. We see about 4 people said quite a bit, 2 people somewhat. So maybe there is some sense that that has happened during the pandemic for you. Next slide, Amy. So just in terms of kind of thinking about how to get back on track, or as the jargon we use in our line of work is sort of aligning with our values, how to kind of align or realign is maybe reflecting on, hey, thinking back to that sweet spot and kind of, or what I know about what really drew me to the field of education, you know, what is a value that I want to either realign with or really continue to align with? What gives me energy in this field and helps me feel a sense of purpose and meaning? And what do I need to get more in line with that value? And then you can start to kind of set some goals for yourself from there potentially. And in a few moments, Amy is also gonna kind of talk you through setting up a recovery plan for yourselves and kind of starting to make a plan, and potentially kind of, you know, incorporating values and getting in line with values might be something you would think about, or could think about in doing that. Next slide, Amy. So maybe again, just taking a minute for yourself and thinking about a value you might want to focus on to reconnect to that professional sense of purpose. Or if it's something that you feel like you've maintained through the pandemic, which is lovely, how do I kind of really keep feeling my connection and my movement toward this thing that I care a lot about that drew me to the field? And then next slide, Amy. And in terms of thinking about what you might need or what might help you connect or reconnect to this value, you know, is it that you need resources? Is it perhaps, right, is it a resource issue at work? Might there be advocacy skills? And this is back to a little bit of kind of what Amy opened with in the poll is we're also, you know, we're open to trying to help provide other supportive resources and through the well-being support line. So if there are things you think can help you get here, we want to know and try to support you in that. This could also be like knowing limits and setting boundaries, maybe with family, maybe with coworkers, maybe with administration to the extent that that feels doable. Finding or reconnecting with people who get it. And I'll talk a little bit more about that in a minute. But just kind of, you know, being able to share about values with one another. And, you know, there were definitely some similarities and overlap in what you all shared. Maybe this looks like having to kind of really reprioritize and letting go of something that's also a value, but less important, being kinder to myself on the way, or maybe something else. Next slide, Amy. So what can we do to, you know, recover and try to start shifting into generating hope? We were hoping also today to send you out with some ideas, some tools, hopefully start to help you feel some hope if you're not feeling that yet, or build on that hope if you have some, to kind of look forward. Slide, Amy. So a couple of just, I think, I wanted to share a couple of fairly usable, portable tools that you might think about today. And one of them, again, is to try to get a little bit of perspective on this year. And to be clear, this is not to suggest, look on the bright side or see the silver lining if you can't or you don't, because that's not going to feel very good. And it can still be helpful to kind of zoom out a little bit and think about this year in the context of your whole career and yourself as an educator. And sometimes what can be helpful when we're in the middle of something really hard is to think about how we're going to remember it, years out. How am I going to think about it in 1 year, 5 years, 10 years? And I even thought kind of a fun exercise might be to imagine what your students will think about it. I was sharing that, kind of having a conversation with another parent the other day, talking about what we think our kids will remember, about this. And, some of them are like unexpected things. Someone said, it's like going out to eat in those igloos, if to the extent they go away. I guess some restaurants are talking about keeping them now, but if those go away, like that was kind of a unique thing for this period of time. And, she thought her kids were really going to remember that. So just kind of trying to understand we've been through something really hard, and this has been a year in time, and there's a lot more ahead of you, right? Next slide, Amy. And then kind of building on a little bit of that idea of emotionally processing grief and trauma, to the extent that that's been, that's what it's felt like to go through this past year plus. And I wanted to kind of offer up a range of ideas, a range of tools here. So, all the way from this kind of just in the moment, we know what's healthy for grief is to label our emotions that we're having in response to it and kind of let them be there to the extent we can. We're not always in an opportune place to do that and really connect with sadness, anger, frustration, whatever feeling might be there. And then sometimes we are, and kind of allowing that to be there for ourselves to the extent we can is actually a really healthy way to move through that. And kind of along with that, if we can find others who get it and kind of get what it's been like to go through it, and talk and share with them, that can be really healthy as well. Now, caveat there is, if folks are all feeling really worn down, sometimes it is not restorative to share with, with others who are also feeling really depleted. So you kind of have to, I always encourage folks to be pragmatic there. If it feels helpful, sharing with a particular group or a group of folks, do more of it. If it feels like sort of a suck, and that those are, an energy suck, and that, everyone is so struggling, then sometimes that's not as helpful. And you might want to think about other supports instead. Expressive writing. So there's actually a lot of really good data that writing about hard experiences and reflecting on them, even fairly briefly for 10 or 15 minutes at a time, a couple of times, can really help folks put some of this into kind of process it and put it into perspective for themselves and move through some of the grief and difficulty. And I'm actually, we will post, I have a handout on doing expressive writing. This is something that y'all could do on your own, for a few minutes a week if you wanted to kind of have an outlet there. And I'll post that handout on the website, and probably if you Google it, you could find just some guidelines on kind of how to think about that too. But essentially, it's just kind of writing about thoughts and feelings about what you've been through, and kind of seeing where that takes you, and doing that a couple of times. That brings a lot of emotional relief for a lot of folks. I referenced earlier, just to the extent you can find some meaning or some areas of growth that you can connect to and sort of build on or savor about what you've been through, in addition to what's been so hard, that can help folks kind of move through the grief or trauma process. And then at the other end of that spectrum, and because I guess with the line of work that I'm in, throw out therapy there as well as a more, maybe more a bigger commitment, a more involved intervention, but certainly one that that would be very appropriate for helping kind of put in context what folks have been through. So then I'll go ahead and turn it back over to you, Amy.
Great. So before we move forward, I just kind of wanted to open it back up. Again, you feel free to unmute or ask questions via the chat. I just want to, before we move on to the hope piece, I want to open it up to see if anyone has questions about this value-based work, or even comments on kind of, again, how your values have been changed as an educator, or how you might use your values to move you forward through the summer and into next year. So I just want to give a few minutes to see if anybody would like to ask questions or has comments on that. Okay, well, oh, there is a chat here. It says I think I need to find a profession that well-being. Wow, what a fantastic statement. What a fantastic statement. And I think that I think a fantastic statement around educators, and we're going to talk about this. You're right, their mental health probably has been put last. Of how do we take care of the kids? How do we take care of the parents? I think there's lots of questions about what are we doing for the teachers. There was a follow-up comment there too that says, I think society's done a lot of gaslighting of educators, telling us if we don't go back in person, we don't care about the kids. I don't know if other people want to comment on that, but I think that's really true, as I think there was a lot of statement of again, outside people challenging your values, of saying, if you don't come back, or if you don't want to do this, or if you want to, again, if you say, I don't like teaching virtually, it means you don't like the kids. And I agree. I think there needs to be a place to tear that apart. Fantastic comment. Another comment here, one of the things the pandemic has done is taken away our activities, and we're gradually doing more that feels good. That's a value. I want to thank you for that comment there, John, because I've been doing a lot of kind of happiness work over this time. And I know that sounds a little counterintuitive, but to kind of help people. And I tell people trying to find happiness during the pandemic is like swimming in a bathtub. That if you had come into therapy a year and a half ago and said, I need help, I'm feeling sad or depressed, I'd be like, go meet up with friends, go to a concert, pick up a new hobby or activity, get out. And suddenly that became really bad advice. And so I think that's the other dilemma, is that all of these things that we normally do to make ourselves feel better, we can't do. And especially, again, for you guys as educators, to say, what were the things you used to do to recharge and rejuvenate yourself, and you may not be allowed to do it?
Yeah, I would just add to that, Amy. I mean, that is that's such an important reflection. And I mean, I've shared this with many folks over the past year. All these distancing measures that we've taken over the past year have been seemingly really, really effective and good at limiting spread of COVID. And helping the pandemic, and they're just terrible for our well-being in almost every other way, right? I mean, they just are not, they're not good for our well-being, and so many folks are missing that. And actually, one of my ways I've reconnected and kind of felt joy recently is hearing stories of folks perhaps getting vaccinated, or community numbers being lower, and starting to feel personally more comfortable starting up some of those things they've been missing. And that's actually been those have been really neat stories to hear. I hope that trend continues and folks feel more able to do that. But as that's a value, hopefully y'all are going to feel able to reconnect to some of that here going forward in this summer.
I agree. And thank you, Dina. Any other questions or comments? If not, I wanted to move on to kind of, for me, what I feel like it is a hard conversation, but also really important, which is, how do we move forward? This has been a really challenging year, and I don't want to invalidate that. But at what point do we start to heal, and do we get to heal, and what do we do to make that happen? So let's go ahead and continue with some of our presentation. Again, feel free to chime in with questions. And so I want to first talk about this. And like I said, I do lots of happiness work. That's kind of what my passion is, really, that my purpose and meaning is around talking about happiness. And one of the things that you guys may find interesting is that although there's not necessarily one profession that is happier than others, when we do kind of try and rank these, educators fall at the top routinely. Now, elementary school and preschool educators, top 5. High school teachers, top 10. Sorry, middle school teachers, you guys have to work a little bit harder. But in general, teaching, is a happy profession. And part of that, I think there are reasons. When we think about happiness skills, educators get some of these, and you guys even talked about them. One is the relationships, getting to be able to really, support those relationships. Altruism, feeling like you're doing something good in the world. And fun. I mean, you got to admit that there are times when teaching is kind of fun. All of those are important, but I also think my theory on why educators routinely score as the happiest professions is because they get to start over every year. On one hand, if you had the worst class you ever had and kids driving you crazy, what's the good news? Next year, you don't have to deal with them. You tried a lesson this year that didn't work. Good news is you can revise it and try again next year. So in building off that, that's one of the places I want to start is what will be different next year, knowing that you get to start over. You get to wipe the slate clean a little bit and start over. How will next year be different? So again, some questions to consider, and we can throw this up on the whiteboard. So just some things to think about. What am I most looking forward to next year? Again, what am I excited to never, ever have to do again? But on the other hand, what might I miss? And what are the things that worked well? So I want to stop sharing again. I want to put up our whiteboard again here and have you guys answer some of these questions. First and foremost, what is something you were looking forward to not having to do next year? That hopefully we won't have to do. What's something that you're glad you will not have to do next year? Daily student health screenings, absolutely. Less screen time, more movement, yes, and throughout the school. Isn't it going to be great when those elementary students can go back to specials and not have to do them in your classroom? Not having to track down students who log in but don't participate? Yes, I think how many of you are going to be so grateful you don't have to stare at a blank Zoom screen wondering if anybody was there. Weekly COVID tests, absolutely. So, okay. I'm going to clear really quick, and I want actually to say, but what's something you actually maybe enjoyed and you might miss? And maybe you'll keep. Maybe you'll keep it for next year. So some work from home, maybe cohorting with classes. Again, maybe that worked really well. Some new resources for students. Yeah, actually, again, as you guys mentioned, that some of the technology that you were forced to learn may actually be really helpful and really cool moving forward. So some not much. I enjoyed not commuting. Amen to that. You're not the only one. All right. And then again, this notion of building hope, I'm going to go ahead and clear. And again, I want you to think about what is, when COVID's finally gone and we don't have to deal with it anymore, what is the one thing you're looking most forward to? And whether that be going to concerts, eating in restaurants, hugging people. What are you most looking forward to? Again, hopefully by next September that we can do. Travel and concerts. Yes, absolutely. Going to the movies. Friday night at a restaurant and visiting family. I'm most looking forward to visiting family, going to the theater, and traveling. Normal activities at school, homecoming, sports, yay. Leaving the mask at the door and not always having to ask, do you have your mask? Again, athletic events. And I will say, I know this one may sound a little silly, but one of the things I'm really looking forward to is doing school pickup again, because I liked hanging out with the other parents, waiting for the kids to come out. I like saying hi to the teacher and seeing what the day was like. I'm going to be so glad when we can kind of hang out and socialize again on the playground once it's safe to do so. So let's think about, how do we use that to really build a plan? You know, so again, thinking about that, how do we get there? And again, back to this recognition that, you know, all of us are in different places in how we need to get there. And so again, it may be, you may need individual treatment or individual therapy, or maybe again, as Dana said, talking with other people who get it. Again, support. Maybe you need some idea that you know you're going to be supported by your family if you decide to stay in education or if you decide to move on. Knowing that if you do go back, that you have people who will help you do that. Again, thinking about recovery. I think one of the things that struck me most as working the well-being line is how much educators are working, even over their weekends, even over their breaks. And is there a place where you can really take this summer and say, I don't want to do anything that has to do with school? Nothing. And then ultimately we need system changes. And is that something that we can help with? So again, here's some things that you can kind of jot down and that you guys can definitely talk about as we move into the breakout rooms. Like Dana said, these slides will be available on our website to really think about, how do you build a recovery plan so that next year you can start over? So that next year you're not plagued by everything that happened this year and how hard this year was. And again, I don't want to invalidate how hard this year was, but to say, when I get to start over, what do I need to be able to do that? And again, how does that align with my values? And how can I build on the growth that I've had? And again, how can we help you with that? So before we move on further, I just want to take a second and ask what questions you guys have. What questions do you guys have? If not, I'm going to share a couple resources, talk about where we want to go, hopefully with your help and your support, and then we'll send you to breakout rooms where you have the opportunity to talk about this more in depth if you would like to do so. So are there any questions talking about hope and how we build hope? What's the Wellbeing Support Line? I will get there. Thank you for asking. The Wellbeing Support Line is a 7-day a week. We are open from 8 to 8 via text and call, and educators can call in with whatever they need to talk about, to complain about your boss, to complain about the parents, to get suggestions about how you teach reading with masks on. Really basically anything that you might need to help support you as an educator. We're available via call and text, and I'm going to put the phone number up here right now, here in a minute. Other questions about hope and building hope? All right, let me go ahead and share then kind of our last few resources. And I just want to kind of acknowledge this again, this notion of how do you prioritize your own mental health? I was in a training the other day actually about trauma-informed care for students and thinking about how do we help our students recover from this time. And one of the things that struck me most significantly when we're thinking about how we're going to help our students is the bottom rung right there, which is we need a stable workforce. And so again, for our students to get better, we need our educators to be better, and we really need to support our educators so that they can provide all of these other things. And so again, in a way that there's a space to say, how do you really prioritize your own mental health so that you can be available to really, again, hold up the kids, because you're going to have to do it anyway. And again, I think this notion that someone mentioned before is this gaslighting of you don't care about the kids. Well, in fact, you guys need to care about yourself first. You do, so that you can be safe and healthy and take care of the kids moving forward. And then again, finally, if we can help you, we would love to help. We have this available. Like I said, we're available via call or text 7 days a week. I'm happy to send you flyers that you can pass out to your friends, your coworkers, and we're going to be available through the end of June. So we are available to help you come up with a recovery plan. We're available when you need to talk about some of this and you want to go through some of this. Just give us a call or give us a text. We're happy to help walk you through kind of what comes next. We are also planning, and this was why I asked some of those polling questions, is we are also planning to do some individual and group therapy. We're going to make that available, and hopefully we can find ways to share that with you when that becomes available. But luckily, the State Office of Behavioral Health has recognized that educators may need a little bit of extra support. And so we're trying to make those services available. And that's why I wanted to ask, how do we do that? So I want to turn it over now to see if anybody else has questions. Otherwise, we can send you guys to breakout rooms if you would like. All right. Any other questions that we can answer? Otherwise,
thank you all so much for being here, and thank you so much for your responses and participation in the exercises. It's really, I think it's more valuable for all to kind of hear and share experiences. So thank you for being a group who participated too.
all right. So I'm going to go ahead and open up the breakout rooms. If you'd like to stay and get some support, great. Dana and I are going to hang out here in the main room if you have questions. And again, we're available here for you guys. And again, contact us on the well-being line if you would like. Hi, Rosario. I can see you. Do you want to go to a breakout room? Just hit join if you do. And you can talk to Kimberly there if you want. Oops. Ah, I closed the rooms. I don't know how to cancel that. Ah. How do I cancel that? Sorry, I think I closed out the breakout rooms.
Yeah.
Oops.
Whoops. All right, let me send people back to. All right.
Sorry, I don't know how to help you with that, Amy.
I don't know how to help myself with it either. I just clicked on